the Spanish Medical Interpreters online class. We are happy to have you all here. Let's first review the learning objectives for this class. After participating in this class, you will be able to recognize and write the functions of the digestive system, recognize and write the meanings of Chapter 9, word parts, and use them to build and analyze terms. Write terms for selected structures of the digestive system and match them with their descriptions. In addition, you will be able to write the names of the diagnostic terms and pathologies related to the digestive system when given their descriptions, and match terms with their meanings. Match surgical and therapeutic interventions for the digestive system, and write the names of the interventions when given their descriptions. And spell terms for the digestive system correctly. The functions of the digestive system are 1. Alimentation, which is the process of providing nutrition for the body. 2. Ingestion, which is the orally taking of substances into the body. 3. Digestion, which is the mechanical and chemical conversion of food into substances that can eventually be absorbed by cells. 4. Absorption is the process in which the digested food molecules pass through the lining of the small intestine into the blood or lymph capillaries. 5. Elimination, removal of undigested food particles. 6. Defecation, elimination of wastes through the anus in the form of feces. For number 6, the term defecation. It is analyzed as follows. The prefix de means down, from, reversing, or removing. The term fex means waste matter, and suffix ation means action or process. Major classes of nutrients, carbohydrates, proteins, and lipids, or fats, are the three major classes of nutrients. Sugar and starches are the main carbohydrates. Whole grains, vegetables, fruits, and beans are good sources of carbohydrates. Although beans, nuts, and whole grains are good sources of protein, they must be combined with each other or dairy products to provide complete protein source. A complete protein contains all the essential protein building blocks that the body needs. Complete proteins are available from eggs, dairy, and meat. And lipids or fats serve as an energy reserve.
Chemical breaking down of nutrients into simpler substances requires enzymes, catalysts for chemical processes. Remember that O's is a suffix for sugars and A's is a suffix for enzymes. The enzyme that acts on milk sugar or lactose is the lactase. The enzyme that acts on starch is the amylase. The enzymes that act on proteins are the proteinases or proteases. The enzymes that act on fats are the lipases. Specific enzymes act on different types of sugars and other organic substances. The suffixes O's meaning sugar and A's meaning enzyme are generally used in the terms referring to the sugars and the enzymes that act on them. For example, lactase and lactose. The eventual product of the digestion of sugars as well as starches is glucose, a simple sugar that is the major source of energy for the body. The enzyme that breaks down starch is amylase. The effective enzyme that breaks down protein is called protease. The effective enzyme that breaks down a lipid or fat is a lipase. The prefix ation stands for action or process. Example, alimentation. The combining form bili and col stands for bile. Example, biliary. The combining form cero stands for orange-yellow. Example, cirrhosis. The suffix d means down, from, reversing, or removing. Example, defecation. The combining form for glucoso means sugar. Example, glycosuria. We will give you a brief explanation for each term that we cover in this slide. Bile is a digestive fluid produced by the liver and stored in the gallbladder. It helps break down fats in the small intestine. Biliary is related to bile, the bile ducts or the gallbladder. The biliary system includes the organs and ducts that produce, store, and release bile. Cholesterography is an imaging test used to examine the gallbladder. It involves taking X-ray images after the patient swallows a contrast dye that highlights the gallbladder. Cirrhosis is a serious liver condition where healthy liver tissue is replaced by scar tissue, impairing liver function. It can result from chronic liver diseases like hepatitis or long-term alcohol abuse. Defecation is the process of expelling solid waste feces from the body through the rectum and anus. Glycosuria is the presence of sugar glucose in the urine, which is often a sign of diabetes or another condition affecting blood sugar levels.
The prefix orexia means appetite. Example, anorexia. The prefix pepsia means digestion. Example, eupecia. The combining form vago pertains to the vagus nerve. Example, vagotomy. The vagus nerve controls the release of stomach acid, so to decrease that acidity, a vagotomy may be performed. The combining form viscero pertains viscera, as in internal organs. Example, visceral.
Structures of the digestive system. The alimentary tract, beginning at the mouth and ending at the anus, is basically a long, muscular tube. Several accessory organs, salivary glands, liver, gallbladder, pancreas, are also shown in this picture. Digestion begins in the mouth, or oral cavity. The teeth grind and chew the food before it is swallowed. The pharynx, or throat, passes the chewed food to the esophagus, which leads to the stomach, where food is churned and broken down chemically and mechanically. The liquid mass is passed to the small intestine, where digestion continues and absorption of nutrients occurs. The three parts of the small intestine are shown: duodenum, jejunum, and ileum. Undigested food passes to the large intestine, where much of the water is absorbed. It is then excreted from the anus, the opening of the rectum on the body surface.
Combining forms of the upper gastrointestinal tract. The upper gastrointestinal tract consists of the mouth, pharynx, esophagus, and stomach. The lower gastrointestinal tract is made up of the small and large intestines. Memorize the following word parts. Chailo means lips, gingivo means gums, glosso and linguo mean tongue, oro and stomato mean mouth, esophago means esophagus, and gastro means stomach. Please describe the meaning of each of the following words. Identify the prefixes, stems, and suffixes. Chylorrhaphy, gingivitis, glossoplasty, sublingual, stomatitis, endogastric. One volunteer at the time, please.
In the figure 9.5, you can see accessory organs of digestion. In section A, you can see the mouth with raised tongue. The salivary glands, paired parotid, sublingual, and submandibular glands, which consist of numerous lobes connected by vessels and ducts. In section B, you can see the location of the liver, the gallbladder, and pancreas. The accessory organs of digestion produce substances that are needed for proper digestion and absorption of nutrients. The liver, gallbladder, pancreas, and salivary glands are accessory organs to the digestive system, as shown in figure 9.5. Both the liver and the pancreas have additional functions in other body systems. The salivary glands are located in the oral cavity. Saliva is produced by these glands. Saliva moistens the oral cavity and contains amylase, the enzyme responsible for the breakdown of starch. Because amylase is contained in saliva, starch digestion begins in the mouth. The liver is the largest internal organ. It performs so many vital functions that you cannot live without it. The liver produces bile, which breaks down fats before absorption by the small intestine. Biliary means pertaining to bile. Bile is continuously produced by the liver and is either stored by the gallbladder or transported to the small intestine for immediate use. Cholecystic means pertaining to the gallbladder. The main duct that conveys bile to the duodenum is the common bile duct. Choledochal means pertaining to the common bile duct. The pancreas has two important functions. It produces pancreatic juice, which is important in the digestion of food. The pancreas also produces insulin, a hormone that regulates the blood sugar level. Let's continue with more combining forms of the upper gastrointestinal tract. Intestinal and entero mean intestines. Duodeno means duodenum, which is the first portion of the small intestine. Jejuno means jejunum, which is the second section of the small intestine. Ilio means ileum. That is the distal part of the small intestine. Colo means colon or large intestine. Appendo and appendico mean appendix.
The combining forms ceco, sigmato, recto, and ano are also combining forms for parts of the digestive tract, which are the cecum, the sigmoid colon, the rectum, and the anus. Procto can refer to either the anus or the rectum. A proctoscope is an instrument used to examine the interior of the rectum.
The large intestine is much broader and shorter than the small intestine. It is composed of the cecum, colon, rectum, and anal canal, figure 9.4. The first part of the large intestine is a blind pouch only a few inches long called the cecum. The vermiform appendix, a worm-like structure extending from the cecum, is best known for becoming inflamed. The ileocecal valve is a group of muscles that are located between the ileum and the cecum. The colon makes up the major portion of the large intestine. The colon consists of four distinct parts: ascending colon, transverse colon, descending colon, and sigmoid colon. The colon makes up most of the large intestine. Thus, when speaking of the colon, one is often referring to the large intestine in general. The combining form that means colon or large intestine is colo.
Gingiva means the gum. Gingival is pertaining to the gum. Both hypoglossal and sublingual mean under the tongue. Glossal and lingual mean pertaining to the tongue. There are a number of branches of dentistry. Pedodontics deals with the teeth and mouth of children. Orthodontics is concerned with tooth alignment and associated facial problems. Periodontics deals with the study and treatment of the periodontium, the tissue that anchors teeth. Periodontal means pertaining to the periodontium.
The gastroenterologist is someone who specializes in gastroenterology, the study of the stomach, intestines, and associated structure. A proctologist is a physician who specializes in diseases of the anus and rectum, as well as disorders of the colon. The secretion of mucus by the inner lining of the digestive tract facilitates the movement of food. This is facilitated by mucous membranes. The combining form for mucus and mucus is muco.
Quiz select the correct answer for stomato is a combining form for what? A, mouth, B, lips, C, gums, D, stomach. Which is your final answer? Combining forms. Accessory organs of digestion: cholecysto means gallbladder, choledocho means common bile duct, hepato stands for liver, pancreato means pancreas, and cialo stands for salivary gland.
In this video, we will study about gastrointestinal radiography. Assessments of the intestinal tract have been greatly facilitated by radiology and endoscopy, revealing abnormalities such as masses, tumors, and obstructions. An esophagram or esophagogram is an X-ray image of the esophagus, taken while the patient swallows a liquid barium suspension. This procedure is also called a barium swallow. In an upper gastrointestinal series, a barium suspension is ingested to examine the esophagus, stomach, and duodenum. This can also include a small bowel series of the small intestine, either as a standalone exam or part of a comprehensive study. The lower intestinal tract is studied with a barium enema. This involves a rectal infusion of barium sulfate, which helps diagnose obstructions or other abnormalities in the area.
The biliary tract is the pathway for bile flow from the liver to the bile duct and into the duodenum. A biliary calculus or gallstone is a stone formed in the biliary tract, varying in size from very small to 4 or 5 cm in diameter, as shown in figure 9.6. Biliary stones may cause jaundice. See figure 9.11. A right upper quadrant pain, obstruction, and inflammation of the gallbladder cholecystitis. Common locations of biliary stones are illustrated in figure 9.7. The presence of stones in the gallbladder is cholelithiasis. Stones also can become lodged in the common bile duct choledocholithiasis. The presence of a pancreatic stone is pancreatolithiasis. Other causes of obstructions include tumors. Endoscopic retrograde cholangiopancreatography, which abbreviation is ERCP, is an endoscopic test that provides radiographic visualization of the bile ducts and pancreatic ducts. An endoscope is placed into the common bile duct. A radiopaque substance is instilled directly into the duct, and X-ray images are taken. Sialography involves the injection of radiopaque substances into the ducts to demonstrate the presence of calculi. Endoscopy is the examination of the esophagus, stomach, and duodenum with an endoscope. When just the esophagus is examined, the procedure is called esophagoscopy. Examination of the stomach alone is called gastroscopy. And the examination of the esophagus, stomach, and duodenum is called esophagogastroduodenoscopy, EGD. Colonoscopy, or coloscopy, is the endoscopic examination of the lining of the colon. Sigmoidoscopy is inspection of the rectum and sigmoid colon. Proctoscopy is the examination of the rectum alone.
The basic digestive function of the pancreas is to secrete substances to help with digestion and to secrete insulin to help the blood sugar to get into the cells. In this video, we will also describe the general physiology of diabetes mellitus, which is the result of resistance to insulin or not enough insulin. Without enough insulin, glucose stays in the blood. The medical term for this condition is hyperglycemia, and it produces polyphagia, which means excessive hunger and uncontrolled eating. When hyperglycemia is severe and exceeds the renal threshold, glucose spills over into the urine, causing glycosuria, in other words, the excretion of sugar in the urine. Glycosuria leads to polyuria or increased urination, which then leads to polydipsia or excessive thirst. Because of the loss of glucose in the urine, Patients may experience weight loss and negative caloric balance. Polyphagia or excessive eating may develop as a result of calorie loss. Several blood tests, urine tests, and stool examinations are useful in assessing the organs of the digestive system, particularly liver function tests and tests for diabetes. To be accurate when referring to diabetes mellitus, it is better not to shorten the term to diabetes alone, although this is often done. Diabetes mellitus is primarily a result of resistance to insulin, or lack of insulin secretion, by the insulin-secreting cells of the pancreas. Without insulin, glucose builds up in the blood and results in hyperglycemia, an increased glucose level in the blood. The symptoms of diabetes mellitus include polyphagia, which is excessive hunger and uncontrolled eating, polyuria, meaning excessive urination, and polydipsia, which is excessive thirst. Interestingly, the urine sometimes contains glucose, a condition known as glycosuria. The broad classifications of diabetes mellitus are type 1, type 2, gestational, and other types. Each type has its unique characteristics and management strategies. Type 1 diabetes is genetically determined and results in absolute insulin deficiency. However, it's fascinating to note that most people with this gene never develop type 1 diabetes. The specific genetic link and development of type 2 diabetes is unclear, but factors like genetics, environmental influences, aging, and obesity may contribute to its development. Type 2 diabetes is characterized more by insulin resistance rather than insufficient secretion. Gestational diabetes mellitus, first recognized during pregnancy, is a form of carbohydrate intolerance, usually caused by a deficiency of insulin. It typically disappears after the delivery of the infant. However, in a significant number of cases, it returns years later. Another important subclass is called prediabetes, which includes persons whose blood glucose levels are abnormal, but not sufficiently above the normal range to be diagnosed as having diabetes.
Quiz. Choose the correct answer. Coelography is A. Examination of the bile ducts. B. Examination of the bile and pancreatic ducts. C. Examination of the gallbladder. D. Examination of the salivary ducts. One volunteer at the time, please. Hyperlipemia, also known as hyperlipidemia, is usually from an elevation of the lipid, or cholesterol. Obesity is an abnormal increase in the proportion of fat cells of the body. A person is considered medically obese if he or she is 20% above desirable body weight for the person's age, gender, height, and body type. Emesis means vomiting. Hyperemesis is excessive vomiting. Hyperemesis and diarrhea can also interfere with proper nutrition. They can result in dehydration when output of body fluid exceeds fluid intake. Diarrhea is frequent, watery stools, and flatulence is excessive gas in the intestinal tract that can lead to bloating, muscle cramps, and bone pain. Emaciation is excessive leanness caused by disease or lack of nutrition. Malnutrition is depletion of nutrients for body cells, which can be caused by malabsorption, the improper absorption of nutrients from the intestines. The malabsorption syndrome includes the symptoms of anorexia, weight loss, flatulence, excessive gas in the stomach and intestinal tract that leads to bloating, and others. Anorexia is loss of appetite for food. Anorexia nervosa is often associated with psychological stress or conflict and is characterized by prolonged refusal to eat, resulting in emaciation. Bulimia is another emotional disorder associated with food, is characterized by binge eating that often ends in self-induced vomiting, emesis. Cirrho is the combining form meaning orange-yellow, and it is used in the term cirrhosis, a chronic degenerative disease of the liver. Hepatic means pertaining to the liver. Hepatotoxic means destructive to the liver. And hepatomegaly is the enlargement of the liver. Canker sores are ulcers chiefly of the mouth and lips. Please explain the following conditions based on the following example. For colitis, if chilo means lip and itis, inflammation. Then, cheilitis is inflammation of the lip. Now, we need a volunteer to follow this example and explain the meaning of gingivitis, glossitis, and stomatitis. One volunteer at the time, please. Now, we will review some of the diseases and disorders of the esophagus. Dysphagia. Let's analyze this term. Dys pertains to something painful or difficult. Phago means to eat, and ia means pertains to a condition. Therefore, dysphagia is a condition of difficulty eating or pain when eating. Esophageal varices are a complex of enlarged, swollen veins in the lower esophagus that are susceptible to hemorrhage. Again, let's see what esophagitis means. If esophago pertains to the esophagus and itis means inflammation, then esophagitis means inflammation of the esophagus. And gastroesophageal reflux disease, with the abbreviation GERD, is a condition of backflow of the stomach contents into the esophagus. The acidic gastric juices cause burning pain in the esophagus and sometimes in the vocal cords and throat. Repeated episodes of acid reflux can result in esophagitis and narrowing of the esophagus, or an esophageal ulcer. Treatment is elevation of the head of the bed, avoidance of acid-stimulating foods, and use of antacids or anti-ulcer medications. In this slide, we will review some of the diseases and disorders of the stomach. First, let's analyze the term gastritis. If gastro means stomach and itis means inflammation, then gastritis means inflammation of the stomach. Now, gastric lavage refers to the washing out of the stomach, and gastralgia and gastrodynia both mean pain in the stomach, because both dynia and algia mean pain. Gastrocele. If cele means hernia, then gastrocele means herniation of the stomach. A common type of gastrocele is a hiatus, or hiatal hernia, which is a protrusion of the structure through the opening in the diaphragm that allows passage of the esophagus. Often, the protruding structure is part of the stomach too, as shown in this picture. As for gastroenteritis, if itis means inflammation, entero stands for the intestinal tract, and gastro means stomach. Then, gastroenteritis means inflammation of the stomach and the intestinal tract. Hyperacidity is an excessive amount of acid in the stomach. An ulcer is a lesion of the mucous membrane, accompanied by the sloughing or shedding of dead tissue. Upper gastrointestinal bleeding means bleeding of the upper digestive structures, sometimes evidenced by blood in the vomit. And, for peritonitis, we already know that itis means inflammation, and peritino pertains to the peritoneum. Therefore, peritonitis is inflammation of the peritoneum. There you go. We should always analyze the medical terms this way. Let's review some of the diseases and disorders of the intestines. We need one volunteer to analyze and explain each of the following terms: colitis, diverticulitis, duodenal ulcer, and duodenitis. One volunteer at the time, please. Let's continue reviewing more diseases and disorders of the intestines. Enterostasis. Entero means intestine, and stasis means stopping. Therefore, enterostasis is the stoppage or delay in the passage of food through the intestine. Hemorrhoids are distended veins in the anal region. Irritable bowel syndrome, known also as IBS, is abnormally increased motility of the small and large intestines of unknown origin. Lower gastrointestinal bleeding can be caused by diverticulosis, diverticulitis, ulcerative colitis, polyps, colon cancer, rectal cancer, or hemorrhoids, masses of veins in the anal. Now, it's your turn to analyze the following terms: cholecystitis, cholestasis, cholangitis, cholecystography, cholangiogram, cholecystectomy, and laparoscopic cholecystectomy. One volunteer at the time, please. Now, it is quiz time. The term for the stoppage or delay of the passage of food through the intestine is A. Enterostasis, B. Colitis, C. Malabsorption syndrome, or D. Hypoglycemia? Who knows the answer?
It's like she can't believe the question.
Surgical and therapeutic interventions. We will review the following surgical and therapeutic interventions: enteral feeding, nasoduodenal tube, nasojejunal tube, esophagostomy, gastrostomy, jejunostomy, gastroplasty, gastric bypass, anorexiant, antacid, antidiarrheal, antiemetic, laxative, purgative. Please take few minutes to review this picture.
Welcome everyone. Today we'll discuss various surgical and therapeutic interventions related to the gastrointestinal system. Understanding these terms is crucial for medical interpreters as they frequently appear in clinical settings. Here they are. Enteral feeding. This is a method of delivering nutrients directly into the stomach or intestines through a tube. It's used when a patient cannot eat by mouth, but can still digest food. Nasoduodenal tube, a tube inserted through the nose that extends into the duodenum, the first part of the small intestine. It's used for feeding or medication delivery when bypassing the stomach is necessary. Nasojejunal tube, similar to a nasoduodenal tube, but it extends into the jejunum, the second part of the small intestine. It's used for patients who need feeding or medication directly into the intestines, bypassing both the stomach and the duodenum. Esophagostomy, a surgical procedure to create an opening in the esophagus, typically for inserting a feeding tube when oral intake is not possible. Gastrostomy, a surgical procedure to create an opening into the stomach. A tube is placed through the abdomen directly into the stomach for feeding. Jejunostomy, a surgical procedure to create an opening into the jejunum. It involves placing a tube through the abdomen into the jejunum for feeding. Gastroplasty, a surgical procedure to repair or reshape the stomach, often used in weight loss surgery to reduce stomach size and limit food intake. Gastric bypass, a type of weight loss surgery where the stomach is divided into a small upper pouch and a larger lower section. The small intestine is rearranged to connect to both, reducing food intake and absorption. Anorexiant medications that suppress appetite, often used in the treatment of obesity. Antacid medications that neutralize stomach acid to relieve heartburn, indigestion, or an upset stomach.
Antidiarrheal medications that alleviate diarrhea by slowing down bowel movements or absorbing excess water in the intestines. Antiemetic medications that prevent or treat nausea and vomiting. Medications that induce vomiting, typically used in cases of poisoning to expel harmful substances from the stomach. Medications that stimulate bowel movements to relieve constipation. Stronger than laxatives, these medications cause a rapid evacuation of the bowels and are often used before medical procedures like colonoscopies. Understanding these surgical and therapeutic interventions is vital for medical interpreters to accurately convey information between healthcare providers and patients. This knowledge ensures clear and effective communication, contributing to better patient care. Thank you for participating. And if you like this video, please subscribe to our channel and hit the notification bell so you will know when we upload more videos like this. And feel free to share them. Your support will help us to continue to create more videos for you. Thank you for watching, and until next time.
Surgical and therapeutic interventions. Laser lithotripsy, shockwave lithotripsy, cholecystectomy, and laparoscopic cholecystectomy. Gallstones. A common gallbladder disorder can be treated non-surgical with oral drugs, laser lithotripsy, and shockwave lithotripsy. These procedures do not involve surgical incisions, but use lasers or high-energy shock waves to break down the stones, which are then eliminated through the biliary ducts. If these methods are ineffective, a cholecystectomy may be necessary, often performed laparoscopically. In a laparoscopic cholecystectomy, the gallbladder is removed using a laser through a small abdominal incision. Laparoscopy involves examining the abdominal cavity through small incisions to inspect organs like the ovaries and uterine tubes, and perform surgeries such as a laparoscopic cholecystectomy. Surgical and therapeutic interventions. Appendectomy, cholecystectomy, pancreatolithectomy, gastrectomy, hemorrhoidectomy, vagotomy. Note how many surgical procedures have the suffix ectomy, which means excision, while tomy means incision. We need a volunteer to explain the term pancreatolithectomy. What does it mean? One at a time, please. Surgical and therapeutical interventions. Laparoscopy, gastroscopy, colostomy, ileostomy, gastroduodenostomy, gastrostomy, liver biopsy. The suffix stomy means artificial opening, and scopy means visual examination. We need volunteers to describe the meaning of these terms, please. Who can do it? Quiz time. What is administered to cause vomiting? A. Purgative. B. Laxative. C. Emetic. D. Anorexiant. Acronyms and abbreviations. DM means diabetes mellitus. ERCP stands for endoscopic retrograde cholangiopancreatography. GERD stands for gastroesophageal reflux disease. GI for gastrointestinal IBS for either inflammatory or irritable bowel syndrome. LGI means lower gastrointestinal tract. Do you have any questions, comments, or concerns that want to share with us? Thank you so much for joining us in today's session. Your active participation is greatly appreciated. If you have any questions, concerns, or suggestions for enhancing our online sessions, please don't hesitate to reach out to us. We are dedicated to ensuring that your learning experience is as enriching and effective as possible, and we're more than happy to accommodate your specific needs. In the meantime, we encourage you to take some time to review the video, explore your ebook, and engage in the online practice exercises and tests. We eagerly anticipate reconnecting with you in our next online session. Wishing you a delightful remainder of the day.